Hi guys, it's Dr. Zumo here with Parkway Family Chiropractic. I just wanted to take a second to talk to you about ear infections. We get asked this a lot and how chiropractic can help. So, however, ear infections are very common. They are not normal. So you ask, why would your child continue getting these ear infections? Well, it's not because they keep walking through a cloud of bacteria. It's because fluid is accumulating in the ear, inflaming the tissue, and stagnant fluid is the perfect environment for a virus or bacteria to set up shop. So, why wouldn't their ears be draining? You see, when you take a bite of food, it doesn't just drop into your stomach from gravity. Your esophagus is a muscle that milks the food down, and that's why you can swallow even if standing on your head. It is the same process for your ear. There is a muscle called the tensor veli palantini. That is the key to all of this. Its job is to milk the fluid out of your ears so it can drain down your throat. And in kids that get chronic ear infections, this TVP muscle is spasmed, not letting that fluid drain through the eustachian tube correctly. So what would cause the TVP to spasm? 9 times out of 10, we can trace it back to the birth process. The TVP gets its nerve supply from the top part of your neck, which is the most vulnerable part of a baby during the birth process, especially if there was a forceps, vacuum, or C-section delivery where there's a tremendous amount of pressure put on that child's neck. Nerve supply to the TVP gets irritated and stops working. Fluid doesn't drain, and your child will get an ear infection. So you ask, can antibiotics help? Or does drilling a hole seem like the best solution? Not really. And that's why the AAP and countless other medical research articles have said that for decades not to give kids with ear infections antibiotics, not only because they don't significantly help, however, they increase the risk of future ear infections as well as asthma and allergies. They are better off doing nothing at all. So, what can you do? The number one thing is to get the TVP muscle working again, and that's where chiropractic comes into play. With gentle and specific adjustments, we can get the kink out of your child's neck and restore the normal nerve supply to the TVP muscle so that the ears will start to drain. We see this all the time in our office, and it is one of our favorite things we get to see. But you don't have to take our word for it. We can do a thorough and non-invasive nerve scan on your child that will definitely tell us if there is any interference that is causing these ear infections and if we can help. You see, in our office, we offer every patient a certified special technology that we have from NASA that is non-invasive, painless, no radiation, and takes all the guesswork out of it for us. Meet little Weston. He came to us at 4 years old with 2 chronic back-to-back ear infections and had been placed on 3 antibiotics. His ears were continuing to full with fluid, had a fever, and was starting to affect his speech and attitude. On day 1, we got Weston scanned, and as you can see, all the interference we found within his spine. And here you see a scan after his treatments, and you can see how much better they are. And we are happy to report that little Weston is doing great, hasn't had an ear infection since starting treatment with us, and is actually thriving in school. So wouldn't it be great if your child was our next chiropractic success story? Please, if your child has recurring ear infections, please reach out to us. We have 2 offices conveniently located, one in Houston and one in Sugar Land, to help you guys. If you don't have a pediatric chiropractor around you, please reach out to us as well, and we'd be happy to find you one. Thanks.